So, hello everyone. So, today we are going to talk about practice of medicine introduction part. So, basically, in every science, there is a theory. Okay, there is a theory what they want to achieve. Okay, so every science, we have different types of science. Okay, this is our medical science. What we will call it? Medical science. So we have the theory. Every pathy is a different types of treatment way, but every pathy goal is to achieve the health. Okay, this is the fundamental of every pathy. But how we reach the health, it is different in different way, different pattern. How to approach to treat a disease in a different manners. But our goal is to achieve the health. It is the basic ideology, basic thing that we want to achieve. So in that manner, we want to know the medicine. Okay. We talked about anatomy, physiology, how the body structure is there and functions of the body. Okay. And our pathy, about our pathy, we talk that electrohomeopathy, that how the electrohomeopathy, what are the remedies are there, how it works. We talked in basic level. Okay, now we want to talk how to treat a disease, how to approach a disease, and how to prevent a disease. This is the goal of practice of medicine. That how to approach the disease. Okay, approaching of a disease. That this is the biggest thing. We have to know that. Second is how to treat the disease and how to prevent the disease. That second time you will not affect with that disease. How to prevent yourself. Approaching is in every pathy there is a different. How to treat in every pathy we have different treatment plans. Okay, and how to prevent. This is mostly similar in all pathies, mostly. Okay, but in some things they are different things are there. So we will talk in practice of medicine, how to approach the disease, how to treat the disease with electrohomeopathy, and we also know some. We will also talk about something regarding modern medicine also, because in some conditions we have to know the knowledge that how they approach and how they treat the disease. Okay, and we can help the patients that this treatment is not available in our pathy. So basically you have to approach the modern medicine in some conditions. Okay, so this is the basic thing you have to understood. And how to prevent the disease. There are different things like in modern medicine, they will advise to take the vaccination to prevent the disease from the prevention of the like COVID vaccine, TT vaccine. Okay, and in rabies vaccine. Okay, and we have different types of vaccines. We know all this polio vaccine. Okay, to prevent from the prevention of the disease. TB vaccine. Okay, and third thing is that prevention. Okay, I mean prevention in electrohomeopathy is different. In Ayurveda is different. In homeopathy is different. In Ayurveda is different. How electrohomeopathy told how to prevent that. Okay, kindly avoid that food which is not matching your temperament. Okay, this is the thing they will advise. In some cases, they will advise to stop eating sour food. Okay, and avoid taking cold food. Okay, like this, there are different things for prevention of the disease. Okay, so basically, we will talk all those things. Okay, what we are going to study. This is very important. So basically, I selected one book that is very, very important and very, very famous book, okay, which are taught by many. doctors in modern medicine, and they will also refer, number of doctors will refer this book for general plan of treatment. Okay, that name of the book is Harrison. What is the name of the book? That is Harrison Manual of Medicine. So basically, we will try to study this book, but not completely. We will take some topics and we will discuss that. And what are the syllabus in that? It is a very big syllabus. Okay, only this thing take minimum 1 year. Okay, this will take minimum 1 year. Okay, you can able to see this. I hope. Okay. So this is the Harrison's Manual of Medicine. So basically, in that we have different topics. Okay, here with the section one, care of hospitalized patient. Okay, a medical emergency. What are the medical emergencies you will get, like cardiovascular collapse, sudden death, shock, necrotic overdose, pulmonary edema, respiratory distress. We will talk all these things, but not not in a manner like they explained. We have to know that things. Okay, some intracranial pressure, head trauma, accident, hypoglycemia, anaphylaxis, bites, all those things will come. And then we'll talk about common patient presentation. They will come to your clinic, like we have the chest pain, palpitation, cough, edema, abdominal pain, nausea, vomiting. These are the common diarrhea. Okay, headache, syncope, dizziness. These are the things. And we have the ENT things, ENT related things. We'll talk about that. Dermatology related things. We have the diseases. We'll talk about what are the most common diseases. But we have the subject, the dermatology. In that, we will discuss completely about skin diseases. Here, which are the common diseases, we will discuss. And we have the oncology subject here also. But here also some important things we will discuss. Infectious diseases. What are the important infectious diseases we will discuss? Okay, and we have the cardiology. This is also one of the important things we discuss. Pulmonology, gastroenterology, okay, endocrinology, neurology, very important. And we have the subject psychiatric also. So in that we will discuss psychiatric. Here we will not talk about. Next, here we have the disease prevention and health maintenance in the modern medicines, how they approach. So basically, this is the mostly uh, modern medicine approach, but in electrohomeopathy, we will discuss according to electrohomeopathy, not modern medicine. But we will take the help from that book, but we have to know updated things, what are coming in this medical science. Okay. So I hope you understood these things. So we will start from tomorrow, the classes. So anything regarding that, kindly ask.